Welcome back to Long COVID Doctor, an educational series for all of those of you who still have long COVID. I'm Dr. Tim Robinson, formerly a family doctor, a GP for 30 years, and now working in long COVID services for 5 years. I post on all the usual podcast channels as well as on YouTube. And if you find them helpful, please click subscribe and share these postings with anyone that you know who also has long COVID. Let's spread the word and get it out there. So apologies for my usual disclaimer. It's important though. Any advice or treatment that I mention should only be considered after you've talked to your own doctor, your own GP or family doctor. So this is sleep problems in long COVID part 2. So in part 1, I talked about those sleep problems themselves, the symptoms, what our patients are telling us, and also I talked about the causes for those sleep problems. So important that you understand the underlying causes, and I'm sure you'll agree there are quite a few causes for the sleep problems of long COVID, and more importantly, that they're not just because of the fact that you've got long COVID and you're worried about it, or maybe you've got sort of mood disturbance and the effect it's had on your life. No, there are lots of physical reasons that explain why someone will have sleep disturbance. So here we are in part 2, and I will talk about how we are going to tackle those sleep problems. And it comes down to looking at this on 3 aspects separately. So the first aspect is sleep hygiene. The second aspect is sleep structuring. And the third aspect is sleep enhancers. So I'll talk about them each in turn. So firstly, sleep hygiene. What do we mean by this? Okay, well, it's all to do with the environment, the sleeping environment. Okay, the bedroom. Well, it's got to be comfortable. It's got to be warm, but not too warm. Okay, certainly not too cold. So, and certainly not airless. Preferably sort of an agreeable temperature with a window open to some degree. Then the bed. Okay, we sleep on a bed, don't we? So make sure that it's a comfy mattress. And it hasn't got dips in it and it's going to give you sort of backache in the morning. Make sure the mattress is comfy. Then, thinking about the dark. You know, we sleep during the night time, don't we? Well, we've got to make it dark. And so the reason for that is in order to enhance the day-night cycle circadian rhythm. And I'll talk about that in a minute. So basically, in order to make it dark, it's common sense. You need some curtains to stop the light coming in. And obviously in the summer months, it starts to get dark in 4 in the morning. And so, therefore, that's not a good thing, because your eye can sense the if you like, the beginning of the arrival of light, and then that's not good for this day-night cycle. So blackout curtains or eye visors, much simpler, because remember, with the day-night cycle, that's when I talked about in the first part about melatonin, the natural occurring hormone in all of us that's secreted from a part of the brain, a little gland in the brain called the pineal gland, that is secreted only when it's dark. Okay, so the photoreceptors in the eye pick up light. When they are activated, they turn off secretion of melatonin. They turn off the stimulation of the pineal gland, and therefore melatonin is not released. When it's dark, melatonin is released. If it's released, that naturally occurring hormone, melatonin, will encourage us to sleep. That's why it's so important to have a dark bedroom. And then quiet, obviously, again, it's a common sense thing, really. You really want quiet, so no distractions, nothing to keep you awake. So, noisy neighbours, sometimes you can't do anything about noisy neighbours, or traffic outside, or barking dogs. You can't do anything about that, but you can wear earplugs, for example, or put on a white noise machine, or use your phone to transmit white noise. Anything to block out those external noise stimuli that could therefore keep you awake. And then another one is the blue light emitted from our devices. So our mobile phones and our computer tablets. If you go to bed reading from an iPad or scrolling on your through your social media on your mobile, what you don't know is that these screens emit light of a wavelength which is within the blue band, which is an arousing wavelength, okay, rather than a sedating wavelength, if you like. Red light is more and pink and yellow, a more warm and calming type of frequencies of light. So it's common sense, isn't it? If you're using these phones and tablets, etc., in bed to have a read before going to sleep, that's fine, but they say that you shouldn't use these devices an hour before lights out. So think about that. Yeah, pick up a book, a sort of sleep-enhancing novel or something that's going to aid you to go to sleep as well. So that's sleep hygiene, the environment, like I said. What about sleep structure? Well, again, back to the day-night cycle and what we call is the circadian cycle, circadian rhythm, circadian anchoring. So having a structured day-night cycle is really important for that circadian rhythm and hence, like I said, the release of melatonin, that natural sleep-enhancing hormone. But there's another hormone, growth hormone, which is mostly secreted whilst you're asleep at night. And growth hormone is essential for restoration and repair processes of the body, of the brain. I said early on in the first part how important biologically important sleep is for repair and restoration of the cells and tissues. Well, that is, if you like, governed by, strongly influenced by growth hormone. Growth hormone is mostly secreted at night time when you're in bed and asleep. So consequently, it brings it home to you just how important a structured night's sleep is. And so in a way, it's a matter of having a structured bedtime, going to bed at the same time every night, as loosely speaking, certainly within a sort of a half an hour window. Try to go to bed at the same time and turn the light out at the same time. Get into that routine. Likewise, get into a routine of getting up at a particular time. So buy an alarm clock, or our clever mobile phones, have an alarm on them. Use that. I use an alarm to wake me up every morning. So simple. Brings me on to talking about sleep structure. Brings me on to the daytime nap. Okay. Well, I did talk about the problems of an excessive daytime nap, sleeping for 2-3 hours, then can mess up that sleep routine, and you have reverse sleep pattern. So, in a way, a long daytime nap is not a good idea. You should ideally keep a daytime nap to maximum of 20 minutes. And the reason we say this is because it is well known through sleep studies that sleeping longer than this enables you to drop down, descend into really deep, slow wave sleep. Remember the non-REM sleep, the deep sleep, level 3 sleep. And if you come out of that, if you wake up out of level 3, so more than 30 minutes, then you have a condition otherwise known as sleep inertia, in which you feel hungover and groggy and generally rubbishy. And so that's not good because, that's not who wants to feel groggy and hungover and rubbishy? No one. And that's what you'll get if you get sleep inertia. And you'll get sleep inertia if you sleep for more than 30 minutes. So that's why I say try and keep it to 20 minutes for your midday nap. I'm a strong believer in a midday nap. And I've been doing it now for like 10 years. And I wake up feeling so energized and fizzy. It's great. And there are studies to show that a daytime nap, enhances your alertness and your learning ability, your cognitive function, as well as your motor skills. So have a daytime nap. It's really, really, particularly in long COVID sense, patients who have brain fog, it's really important. So I really strongly encourage it. And it will help you, I'm sure. So I've talked about sleep hygiene, sleep structure, and now sleep enhancers. So what do we want to do? We want to promote sedation. We want to promote sleep, but not knock you out, if you like. We want to lead you, enhance you, this lead you into sleep, but not render you unconscious. Because being rendered unconscious is not natural sleep. You're not going to have your restorative levels and phases and cycles that I was talking about in first part with regard to the functions of normal biological sleep. So basically we want to be able to enhance it, promote it. I think before I tell you what we can do to give that enhancement, I think it's important that you take on board that, please, let's be safe here, one at a time, not in combination. Whatever you choose, and I'll go into what the choice is, slowest dose first, please. Start slow, can't start low, go slow, the old adage, Plus also, read the instructions on the packaging. Don't exceed what's on the packaging. Don't be tempted to double the dose, if you're not getting off to sleep. Okay. The other thing is, make sure whichever you choose, does not clash with any other medication you might be on. Okay, so if you are on medication already for other conditions, or indeed for your long COVID, make sure you run it past your doctor first, that it's not going to cause a adverse side effect, a clash. So when we think of sleep enhancers, in a way, it falls into two categories. And I'm going to just call them supplements and pharmacological drugs. Okay, so let's talk about those are from your doctor. So let's talk about the supplements first. Well, there are a number of supplements that actually are evidence-based, which encourage sleep. So magnesium glycinate, 500 milligrams. Again, there are studies, like I said, there are studies that demonstrate that this is effective at encouraging and cutting down what we call sleep latency, how long it takes to sleep, and the sleep duration itself. So magnesium glycinate, which you can get, over the counter from your health food store, or most of the chemists, most of the pharmacies supply these things now. Be careful though with magnesium. You may come across other magnesium salts, so such as magnesium carbonate or magnesium oxide. There are loads of them, but it's the magnesium glycinate that you need, because the other ones don't have those the sleep enhancing properties, but also have other sort of properties. So Epsom salts, for example, it's a magnesium based magnesium sulfate, so it brings about effects on the bowel. So be careful if you choose magnesium, make sure it's glycinate. Then there's nitol herbal, which you can get across the counter from the pharmacy or health food shop. And basically herbal, it contains plant products that have sleep enhancing properties, so called. So hops or valerian or passion flower are usually contained in these type of herbal remedies. But remember, herbal remedies, always be careful with herbal remedies. Again, they can clash with medication that you are on. Check it with your doctor. Bark flower remedies, a lot of people use these flower remedies, such as rescue remedy, to help sleep. And then the supplement that a lot of people are experimenting with is melatonin. So I've talked about melatonin, has come up a few times already, hasn't it? I've mentioned that, the natural melatonin being secreted from your pineal gland. Okay, well, the pharmaceutical industry has produced synthetic melatonin, which you can buy, and it's quite regulated here in the UK, but other parts of the world you can buy it across the counter, no problems. 0.5 to 1 milligram. We use it you can prescribe it, doctors can prescribe it in the UK for learning disabilities or a short course to prevent jet lag, but only in patients over 55. So it's quite strictly regulated as to who can have it prescribed or not. But basically 0.5 milligrams to 1 milligram, sometimes 2, sometimes 3 milligrams, but start low, go slow. And you can have it in tablet or liquid form. You can get a slow release version of it, which is basically it is in, as the word goes, slow release. It is released slowly, and so it's really good for those people who have disturbed night sleep in the early hours, so early morning wakening or repeatedly waking through the night. The only problem of melatonin is that it can cause vivid dreams, it can cause alertness, it can cause nausea and headache. So those are again, like I say, read the packaging and read the small print within the packaging for any potential side effects, etc. And don't take it during pregnancy or driving. Pregnancy, because there are no studies that I'm aware of, studies that show that it is safe during pregnancy. So therefore, it's wise not to take it in pregnancy. I think it's probably fine, but I have to say, don't take it in pregnancy. Don't take it with driving for your driving occupation, or you're about to go on a long car journey. Again, and that's probably common sense, because if it brings you sedation, you don't want to be sedated behind the wheel. So, if you are going for a long drive, you shouldn't take it before the journey. So those are the supplements for sleep enhancement. What about the drugs, the pharmaceutical side? Well, the first one is mention is Piriton, so chlorpheniramine. So it's the first generation antihistamine, which has been basically in use for 50 plus years. It's safe. 4 milligrams, you can buy it over the counter. It's the hay fever, the original hay fever treatment. We don't use it in hay fever really anymore because there are non-sedating antihistamines, second and third generation antihistamines. So because it's first generation, its side effect is sedation. So that's why, in a way, no one uses it for hay fever, etc. But there's no harm in using it for that property of sedative effects. The doctor your GP, your doctor, family doctor may prescribe you, if you've got a bad run of sleep problems, it may prescribe you temazepam or zolpidem, which are benzodiazepine minor tranquilizers, sleeping tablets, in a word. Don't like to prescribe these in not for more than, say, 5 to 10 days, because that can lead to dependency and addictive risk. Instead, you can use amitriptyline, so again from the doctor, which was launched 50, 60 years ago as the first antidepressant. None of us use it as an antidepressant anymore because of its side effects, and one of the most troublesome is the hangover sedating effect of it. And so we don't want to use it because of that reason, but also we don't want to use it because there are so many better antidepressants these days. The slow-release selective serotonin reuptake inhibitors, such as citalopram and sertraline, are so much better for depression. But for sleep enhancement, we often use it as a sort of 10 milligram dose, the lowest dose at bedtime. And that's non-addictive and safe. Your doctor will be prescribing it so that your doctor knows whether it is safe in you if you're taking other concurrent medication. I mentioned SSRIs, selective reuptake inhibitors, and remember what I said earlier on, talking about the causes of long COVID, sleep problems, of which there are loads of biological causes and damage that the virus has done to your system, your normal biology. But, the consequence of long COVID on you may well have led to mood disturbance and anxiety, worries, as well as depression. And if you suspect this, you must talk to your doctor. We want you to be safe. And perhaps a short course of an SSRI will be indicated and needed just to get you out of that pit, that depression phase that you might have unknowingly sort of slipped into. Again, like I said, these newer versions, this citalopram and sertraline of SSRIs, are brilliant at being clean of side effects, effective, non-addictive. So obviously prescribed by our doctor. So there we are. That brings me to the close of part 2, long COVID sleep problems. Like I said, they're common. They're certainly in the top 10. And they're important to address because of, it's another symptom that you might have, but it's also sleep's so important for all those essential biological functions of cellular repair, tissue repair, energy restoration, and metabolic waste clearance, and to dampen down inflammation and restore immune function. Like I said, there are many causes. It's not just because your life's been taken away from you, your normal lifestyle, etc., has been taken away with you and you feel depressed. No. Basically, there are many causes, biological causes, like I've said, and that may lead to, the sort of consequence of disturbed sleep, insomnia, excessive sleep, etc. So I hope you have found that helpful, has covered all those causes and symptoms. And then, like I said, I hope that the strategies to actually tackle have been helpful if you've felt that you want that. Remembering the sleep hygiene, comfortable at night and dark, quiet, careful of those mobile phones, the sleep structure, strict bedtime, lights out, routine, get an alarm clock to make sure you don't sleep in, oversleeping. Yeah, remember the reverse sleep pattern problem. Yeah, get an alarm clock. And then the sleep enhancers, remember the supplements, the magnesium or herbals, melatonin, and then the meds, the Piriton and amitriptyline. And remember, like I said, the selective serotonin, SSRI, reuptake inhibitors, for, if you feel that you may well have become depressed. But overall, this is long COVID, and we are aware now that, it's all to do with time and natural healing, isn't it? Repair of that damage that has occurred as a result of the COVID that's left you with long COVID, the damaged pathways, nerve pathways, those damaged tissues, those damaged brain centers that lead to the sleep problems. We've got to wait for those new cells, those nerve cells to, if you like, regrow and reconnect. The neuroplastic processes. We've got to wait for, those blood clots to be cleared by recanalization and dissolved, or new blood vessels to bypass those blockages. And we've got to wait for inflammation to settle. Along with time and natural healing, the other really biggie is, acceptance. We've got to come to terms with this. We've got to accept it. And that will then lead to, if you accept it, there'll be less distress, less frustrations. That leads to natural healing as well, aided by, lifestyle measures, or, which I cover in other updates, of focusing on nutrition and sort of reducing stress, etc. So there we are, my update on sleep problems in long COVID, and I hope you found it helpful. As I said at the start, this is an educational series for you long COVID sufferers, and I hope you found it helpful. Remember my normal disclaimer though, any advice and treatments that I've mentioned, discuss with your doctor. Remember, safety first. So, like I said, if it's been helpful, share it with anyone else that you know has long COVID problems. Click subscribe. Thanks for your feedback. As I said before, I just haven't got time to get around to addressing, your inquiries, etc. I wish I could. So in the meantime, I wish you well with your long COVID recovery. And so until the next time, all the very best. Cheerio. Bye.